If you enjoyed this podcast summary, please consider subscribing. Dr. Stacey Whitman, a functional dentist, emphasizes the importance of oral health as a key feature of overall gut health and a powerful modulator of brain longevity, heart health, hormones, and fertility. She explains that the traditional approach to oral health, which involves using astringents, alcohols, and foaming agents, can damage the delicate oral microbiome. Instead, she advocates for a less is more approach, focusing on diet and lifestyle to optimize oral health. Dr. Whitman notes that many common over-the-counter toothpaste contain ingredients like sodium lauryl sulfate, which can be disruptive to the oral mucosa and lead to oral ulceration. She encourages people to read the ingredients on their oral healthcare products and understand what they do and why they're there. She also notes that essential oils, while natural, can be antimicrobial and damage the healthy bacteria in the mouth. The conversation touches on the topic of fluoride in toothpaste, with Dr. Whitman explaining that fluoride changes the structure of hydroxyapatite, the mineral that makes up teeth, to fluorapatite, making it more acid-resistant. However, she notes that fluoride is not selective and can damage beneficial bacteria in the mouth. Dr. Whitman emphasizes the importance of diet, lifestyle, and gentle oral care practices to optimize the oral microbiome and promote overall health. She encourages people to think of the mouth as the gateway to the body and to prioritize oral health as part of their overall wellness routine. The conversation also touches on the topic of nasal breathing, with Dr. Whitman explaining that mouth breathing can lead to dry mouth, cavities, and gum disease. She suggests that people should focus on hydration, mineral-rich diets, and nasal breathing to maintain healthy saliva. Dr. Whitman discusses the importance of testing the oral microbiome, which can reveal keystone pathogens that can contribute to various health issues, including Alzheimer's, dementia, and cardiovascular disease. She also notes that a deviated septum can be caused by a narrow palate, and that expanding the face through functional orthodontics can help straighten the septum. The conversation shifts to the topic of oral health and its impact on fertility, with Dr. Whitman explaining that research has shown a link between gum disease and fertility issues in both men and women. She suggests that fertility clinics should focus more on oral health and that testing the microbiome of patients could be a valuable tool in improving fertility outcomes. Dr. Whitman emphasizes the importance of flossing, particularly at night, to remove food particles and disrupt the biofilm that can lead to cavities and gum disease. She also suggests using floss picks, which can be easier to maneuver, especially for children. The conversation touches on the topic of fluorosis, with Dr. Whitman explaining that it's a condition caused by excessive fluoride consumption. She notes that mild fluorosis is usually more bright or white and can be seen on the incisal tips or on the cusp tips of the molars. The debate around fluoridization of water is a contentious issue, with some arguing that it's not safe for consumption. Dr. Whitman believes that the aesthetic concerns surrounding fluorosis may be the key to changing the conversation around fluoridization. The conversation also touches on the topic of burning mouth syndrome, which can be a sign of zinc deficiency or vitamin B deficiency. Dr. Whitman notes that the mouth is the gateway to the body, and that nutritional deficiencies can often be seen in the mouth. Dr. Whitman emphasizes the importance of chewing equally on both sides of the mouth and the potential consequences of not doing so, including hypertrophy of the muscle on one side and a shift in the way the face grows. The conversation shifts to the topic of tongue tie, with Dr. Whitman explaining that it's not just about whether or not to cut the frenum. Instead, it's about assessing function and determining whether the tongue tie is impairing or impacting breastfeeding, speech, or chewing and swallowing. Dr. Whitman shares her personal experience with tongue tie, noting that she had a posterior tongue tie and had it released during a tonsillectomy. She emphasizes the importance of working with a myofunctional therapist before and after the procedure to ensure optimal outcomes. The conversation touches on the potential benefits of red light therapy, which can reduce inflammation and improve blood flow, particularly post-surgery. However, Dr. Whitman notes that there's limited data on its effectiveness for general oral health. Dr. Whitman emphasizes the importance of sealants, which can reduce cavity risk, especially for children. She uses spectrometry to ensure she's not sealing in bacteria, and employs ozone and lasers to disinfect the area. The discussion takes a somber turn as they address the high rates of depression, anxiety, and suicide among dentists. Dr. Whitman shares her personal experience with the challenges of being a dentist, including the pressures of running a business, managing staff, and dealing with difficult patients. Dr. Whitman emphasizes the importance of kindness and understanding towards dentists, who often face negative stereotypes and high expectations. She stresses that oral health is not just about teeth and breath, but also about overall digestive tract and brain health. The conversation concludes with Dr. Whitman encouraging listeners to take control of their oral health and providing actionable tips for improving their overall well-being. She emphasizes the importance of prioritizing oral health as part of their overall wellness routine and encourages listeners to think of the mouth as the gateway to the body. Main learning from video out. Dr. Whitman emphasizes the importance of a less is more approach to oral health, focusing on diet and lifestyle rather than harsh product. She explains that many common toothpastes contain ingredients that can damage the oral mucosa and lead to oral ulcerations. Instead, she recommends using gentle biomimetic materials like hydroxyapatite to support the oral microbiome. The conversation also touches on the importance of nasal breathing, testing the oral microbiome, and the link between oral health and various diseases like dementia and cardiovascular disease. By making simple changes to our diet and oral hygiene routine, we can reduce the risk of these diseases and promote overall well-being. Key takeaways include the importance of a balanced diet, limiting processed foods, and using gentle oral care products. By prioritizing oral health, we can improve our overall health and reduce the risk of various diseases. If you are interested to listen to complete 20-minute summary and unlock detailed insights for each topic discussed in the video, check out quick podcast summaries on Spotify and Apple Podcasts with free trial, and later just for the price of candy. Happy listening?